can you just tell me what are the signs, symptoms? Very important. Once we know the risk factors, we have to know, a public has to know, how do they understand that they have got a carotid artery disease, or they have a peripheral artery disease, or a venous disease? What are the clinical manifestations which a common man has to understand?
So let me come specifically to three different types of diseases. One related to carotid, which is the artery leading to the supply of brain. Now here, if you have a disease or blockage there, what happens is the blood supply to the brain can suddenly get occluded, or a small cholesterol material can actually fly off into the distal brain arteries and cause choking of those blood vessels. And this can lead to a stroke, which we call as lakwa in Hindi, or paralysis. Now, there are different grades of this. The initial grade is just a TIA for a few, which is known as transient ischemic attack. For just a few minutes, a few seconds, you may have a slurring of speech. You may have transient blindness, either fully or in one half of the vision, or you may have sudden weakness in one half of the body or one limb, or you may have weakness in one half of the face, or you may have sensory phenomena, anesthesia, that means loss of sensation or abnormal sensation in one half of the face or one half of the body. And these are very, these are warning symptoms of a major brain attack. And if you have these symptoms along with, slurring of speech, which is transient, you must immediately go to the doctor. This is like an angina before a heart attack. Now, the other symptom is when the full-fledged attack happens, and this is known as stroke. And at that stage, you may have three things. You may have paralysis, complete paralysis of the body, one half of the body or one limb or of the face. You may have alteration in sensorium. That means you may become, very groggy, or you may just faint. Or you may just come up with sensory phenomena, that you may lose sensation in one half of the face or one half of the body, or you may have blindness. So these are the different ways the carotid arteries can manifest. These are the symptoms. Now let's go down to the peripheral vessels, and I'll specifically limit this to the lower limb vessels. You may have again a similar sort of phenomena. If the blocks are of high degree, but still there is some supply to the legs, what will happen is when you walk, you will have pain, and when you rest, the pain goes away. This is known as claudication. And if you don't treat it at this stage, this actually progresses to more and more advanced stages. And what happens is that you may not be able to walk up to 100 meters, or maybe not even to the toilet. Even at that stages, you may have pain. So there are different grades of claudication, or this pain of the lower limb, which we classify from 1 to 6 grades. And if you don't treat it at this stage, what is going to happen is you may develop an ulcer or a wound in the leg, which is not healing. And if you go beyond this, you may actually have gangrene or death of the tissues of the leg. So you must have seen some patients having black leg or cold limb, and suddenly it becomes cold, wet, and foul smelling. So that area is dead, and that needs an amputation. And if you don't do that, this patient may die because of sepsis and toxemia. The other part is if the blood supply to the leg is okay, but suddenly there is something which flows, a clot flows from the heart down into the leg arteries, and it blocks and chokes it suddenly. This is known as acute leg ischemia. It's like a heart attack of the heart. This is like a leg attack. And here what happens is if you don't take out the clot, or if you don't dissolve the clot, what is going to happen is this leg is going to become cold, clammy, and it will not function, and it will become dead. And this will, if you don't amputate, this patient is going to die. And if you have such a patient, you need to treat it right away without surgery. Now we have very good drugs and interventional means, and this leg can be saved, and the patient's life can be saved. But the disease is not in the leg arteries. It's just because there's a clot which got stuck there. The disease, you have to look into the heart where the clot is forming, or in the aorta where the atheroma is there. So these are different types of manifestations of the peripheral vascular disease. And sometimes what you may have is you may have a clot or a blockage in the aorta, which is, I told you, is the main highway or main vessel, feeding vessel of entire circulation to the body. So if you have a blockage in the aorta, below the navel, you may actually have a disease where the patient cannot walk. He may have problems with, peeing and passing, defecating, or the patient may have impotence because the blood supply is not there to his genital organs. So these are different ways peripheral vascular disease can manifest, and that is why it's very important for physicians as well as patients and general public to know what is going wrong. This awareness is very important. Heart, there is a lot of awareness, and that's why we've been able to save a lot of patients. But we have to understand if heart only, the problems of the heart only constitute 20% of the entire arterial problems. 80% problem is because of brain attacks, because of these sort of manifestations, leg attacks and abdominal attacks. So if we are looking at the patient as a whole and blood vessels as a whole, then we can actually save these patients and treat them in time.